teeth grinding. Medical term is bruxism. Dear viewers, if you have dental issues, headaches, jaw pain, and disrupted sleep, then perhaps you may be suffering from bruxism. Mother always notice her child is grinding the teeth during sleep, or your spouse may tell you that you are grinding the teeth in your sleep. Dear viewers, my Facebook and YouTube channel were created on your special request in 2020 amid of COVID-19 pandemic. You are requested to like, comment, share and subscribe. Thank you. Bismillahirrahmanirrahim. Assalamu alaikum viewers. Dr.S.M.Zafeer with you, and you are watching my informative vlog on Facebook and YouTube channel. Is teeth grinding associated with intestinal worms? This is statement we used to hear from our grandmothers. Viewers, नाजरीन, उमूमन हमारी ग्रैंड मदर्स जो है ये एसोशिएट करती थी कि बच्चा अगर रात में सोते वक्त टीथ ग्राइंड करता है यानी दांत को पीसता है तो उसके पेट में वर्म्स होते हैं. लेट्स सी, आर यू रेडी? हियर वी गो. Bruxism or teeth grinding is a condition where a person grinds, clenches, gnashes his or her teeth. Children as well as adults can have this condition. Teeth grinding is a major cause of facial pain, deterioration of teeth, and sleep problems. It is estimated that around 20% of children grind their teeth. Children usually begin grinding their teeth at 4 to 8 years of age. By 10 to 14 years, they grind their teeth more. After the age of 14, grinding starts declining. There are two types of teeth grinding. Number one, awake. Awake teeth grinding may be due to emotions such as anxiety, stress, anger, frustration, tension, or misaligned teeth. Or it may be a coping strategy or a habit during deep concentration. Viewers, you must have seen that sometimes when you become angry, you just clench your teeth and grind your teeth. So this is awake grinding. Now, second one is sleep bruxism or grinding teeth in sleep. May be a sleep-related chewing activity associated with arousals during sleep. Sleep bruxism can run in families. Vitamin D deficiency and low calcium level is associated with anxiety and depression, which may trigger teeth grinding. The typical locations of bruxism headaches are temples, forehead, and behind the eyes, that is retroorbiter. So these are the places where the children will complain pain because of teeth grinding. This is because bruxism or teeth grinding and clenching often leads to tension in the jaw, neck, and head muscles. Investigation should be performed to check if vitamin D and calcium supplementation could relieve sleep bruxism. Teeth grinding in young children is common, and it often goes away by their teenage years. Common childhood habits such as thumb sucking and using a pacifier can lead to teeth grinding. As a child becomes used to having pressure against their teeth, such behavior should therefore be avoided. Treatment of bruxism or teeth grinding is challenging and requires the cooperation of the physician, dentist, parents, and the child. Currently, it is treated with physiotherapy. Treatment methods commonly used for treating teeth grinding in children are kinesiotherapy, massage, infrared therapy, and low-level laser therapy. A mouth guard can also be used to protect teeth from premature wear because teeth grinding will damage your teeth also. Whatever the cause of bruxism, help kids relax before bedtime. They might take a warm bath or shower, listen to a few minutes of soothing music, or read a book. For bruxism from stress, ask about what's upsetting your child and find a way to help. That means you have to uh, address his anxiety and stress. Cutting out habits that promote jaw tension, such as chewing gum, can also help you relax your jaw. Magnesium supplements can help relax the small, fast twitching muscles in your jaw and reduce grinding further. As I told you, that our grandmother used to believe that teeth grinding is due to intestinal worms. This myth from our grandmothers is not totally wrong. So, benefit of doubt, there is no harm to test the stool of a teeth grinding child with vitamin D level and calcium. Parents and viewers, bruxism or teeth grinding has multiple origins, and a visit to a pediatric dentist can help solve this problem. Stay blessed. Thanks for watching my informative vlog on Facebook and YouTube channel. If you like this video, please subscribe and share.